In this video, I'm going to show you how to decompress your back in seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over some great exercises that are going to take pressure off of stiff muscles and tight, achy joints of the lower back. We're going to do it through pulling motions known as traction to help decompress or take pressure off of the lower back. This is especially good for anybody that has disc bulges, disc herniations, lower back pain, and sciatica. All the exercises, they work just a little bit differently, so go through them all, take what works best for you. They can all be done at home and may give quick lower back and sciatica pain relief, even in as little as 30 seconds. So let's get started and decompress the lower back right now. So here's a really easy way to decompress your lower back at the edge of a bed or even at the edge of a couch. I call this one the back hammer. What I'm going to do is lay flat with my upper body on the bed. What we want to do is also roll up a towel or pillow and place it at the edge of the bed. That way we'll have a little bit more support, even more so if your mattress tends to sag. The movement is really easy. I'm going to support my lower body on my feet like this, knees roughly bent at 90 degrees. You can take your hands and place them behind your head like this, or just place a pillow underneath it for extra comfort. What you want to do is place the edge of the bed right at the lower part of the lower back, roughly right at the belt line. You really want to be able to feel your lower body butt going downwards while the bed is supporting it right at that point. That way it's kind of helping to traction open that spot and decompress. What I try to do is just hold this position right here and allow my lower body weight to just go downwards, let gravity take it off the edge of that bed. Do nice, slow, controlled breathing also. In this position, you should really feel a pinpoint spot of a stretch happening over the spot of the lower back. And actually, I just felt a nice little release, a nice little pop into my lower back. That is quite common with this. But I try to hold this position for about 30 seconds. If it feels good, you can hold it for longer, upwards towards a minute. But when you need a breather, just kind of come back up like this and relax and take one. From there, what I like to do is just use my legs and scoot down just a little bit further to target the spot above. In this case, it'd be L4. Again, I'm just going to allow my lower body, my leg weight to go downwards while my back is supported on this flat surface. Do this for 30 seconds, relax, and you can do as many reps as you like if you feel like it is helping. And with these exercises, the decompression exercises, you know that they're really helping if you do have a lot of downward pain, like sciatica going down the legs, and it's starting to come back up towards the back. We call that centralization. That means pressure is being taken off those nerves, and it's not being put onto the sciatic nerve. But just go all the way down, pretty much going from the lower part of the lower back all the way to the top of the lower back. If you do notice like one certain spot, let's say it's right here for me, it just is the pinpoint spot, it's offering me the most amount of relief, I want to make note of that and throw more repetitions in at that point. Always target the spots that need it the most. You can take this one to the next level also by taking your arms like this and straightening them and putting them overhead, and then tilting your body in one direction. So in this case, I'm tilting all the way towards my left. What this will do is really stretch off to the side and hit a muscle called the QL or quadratus lumborum, which is a big instigator of back pain. Do this and notice if it helps relieve more pain. You can also go all the way towards the right. If you do find that doing these movements offer you more relief while doing it, throw some reps in while doing this. Again, always target the spots that you feel need it the most. This exercise is what I like to call the big ball decompress because I'm going to be using a large exercise or stability ball. If you don't have one of these, I will leave a link in this video's description, but they are wonderful because they're going to build stability, balance, and posture throughout the back while also helping to strengthen it at the same time, so you get a nice twofer. I'm going to start off on a floor, on my stomach, just like this. I want to focus on allowing my legs to be off the ball and my back to be supported nice and straight with a stability ball. You can rest your upper body weight right on your forearms like this. Do a nice slight chin tuck also for better posture. I tend to just angle my legs out slightly and then rest my leg weight on my toes just like this. You want it nice and comfortably. It should feel like your leg weight is just being rolled off the ball. So at this point, the legs are being taken down by gravity and a nice stretch is going to form in the lower back, a very good decompressive stretch. So really focus on feeling that.
This position I try to hold for about 20 to 30 seconds, doing nice, slow, controlled breathing also. Just let the tension out. But if it feels comfortable, you can hold this position for an extended period of time, a minute or two. Just grab your phone, a book, anything like that, take your mind off of it. But when you need to relax, just kind of push yourself back up like this and take a breather. You want to do this one for about 3 to 5 repetitions, and with each repetition, focus on allowing the lower body weight, the leg weight, just to roll off the ball even further to get a better stretch. How we can take this one to the next level is to incorporate some dynamic movements in it to challenge the muscles just a little bit differently. So in this position, what I'm going to do is a hip rock. I'm just going to go from side to side very, very slowly with my hips. This right here, you'll just notice that it hits the back just a little bit differently. Try to go as far as you can in one direction, hold it for about 2 to 3 seconds, and then just switch slowly towards the other side. You want to do this one for about 10 to 15 repetitions on both sides. From there, you can do a hula hoop motion. So what I'm doing is just going counterclockwise, rolling my hips and pelvis into the ball just like this. 10 to 15 reps. From there, I'm going to stop, and then I'm going to switch directions and go clockwise with it, just nice and slowly. You can also do a pelvic tilt with this one. So with this, what I'm doing is kind of rocking my pelvis forward into the ball, and then I'm just going to rock it backwards. So just nice and forward with it. You'll notice that this really activates a lot of muscles across the lower back, core, hips, into the pelvis. Do this for about 10 to 15 repetitions. If you feel like you have a little bit more energy, you can throw another set or 2 in. But go through all of these motions. If you feel like one is hitting the back just a little bit more and helping to take pressure off of it, at that point, make note, throw more reps in. Always target the movements and spots that need it the most.
This exercise is what I like to call the Cobra Lean, and it's wonderful because not only can you do it anywhere, but you can also do it standing. It's a 2-part exercise. The first part, we're going to do what is known as a standing cobra. We just need a wall or a door. The movement is very easy. What I'm going to do is put my feet roughly hip width apart. I'm going to take my hands, place them on my hips, and then lean into the door to the point where my stomach and belly button, my hips, my pelvis are flat against the door. What we want to do with our hands is place them on our hips and then drive our hips forward so our hips and our pelvis do not come off the wall or the floor, or I should say the door, like this. So the movement instead, I'm going to bend backwards with my upper body. My shoulders are going to come back while I press forward with my hands. This will put the back into a backwards movement known as extension, which helps take a lot of pressure off the spinal disc of the lower back, helping to decompress it. The further that you go back, the more that you're going to feel a wonderful deep stretch. Only go to a comfortable stretch, not causing any discomfort. Once we hit that point, let's hold this one for about 20 to 30 seconds. Do nice, slow, controlled breathing also. Let the tension out as much as you can. When you need a breather, just lean forward like this and take one. And then you want to do this for 3 to 5 repetitions. With each repetition, try to stretch into it just a little bit more to help decompress the back even further. With the second part, we're going to do what is known as a wall lean stretch. This is one of my personal favorite exercises for anybody that has a disc bulge or herniation. The hardest part about this exercise is knowing what side to place towards a door. If you don't have any leg symptoms like sciatica, you can do this on both sides. But if you do have leg pain, what you want to do is put the non-painful side towards the door or a wall. So remember, good door, good side towards the door. In this case, I'd have a lot of left side going, or I should say a lot of left-sided pain going on. I'm going to put my feet together, and they're going to be spaced roughly about 1 foot to 1.5 feet away from that door or a wall. I'm going to then lean into the door, so my hand, my elbow, shoulder flush against that wall or door. We don't want any space during this exercise. My other hand is going to go on my hip, and I'm going to drive my hip towards the door. What this does is it causes an open wedge to form on the spinal disc that drives bad pressure towards the middle and off any pinched nerves at that point. So the more that we press into it, the more that you're really going to feel a great stretch. Again, we want to hold this one for about 20 to 30 seconds. Do nice, slow, controlled breathing. When you need to relax, just kind of come back like this. You want to do this for 3 to 5 repetitions. And a key with this one too is to only press into it. Don't allow the upper body to come off like this. I see a lot of people try to do this right here, and at that point you're only going to get a shoulder workout. Really focus on driving through the hips right here. 3 to 5 repetitions again for 30 seconds. And again, if you don't have pain on the other side, you can do this on both. It's just a good way to open up the back and decompress those spinal discs very quickly. This back decompression exercise is what I'd like to call the soup can method, because I'm going to be using a large can of tasty beef barley soup, but you can use any flavor that you like. I'm also going to use a large rolled up bath towel for this one. Let's go next to a door or a wall. I'm going to lay flat on my back like this. My hips, my knees are going to be in a nice straight line, knees bent roughly at 90 degrees, and then I'm going to press with my feet into the door or a wall. I find that using shoes during this exercise makes it a little bit easier, but you don't have to wear shoes. You can just wear socks or bare feet. Take your hands and just place them on the back of the head just like this for extra support. So let's take our soup can and then roll it up in our large bath towel just like this. And at that point, we kind of have a homemade foam roller. If you do have a foam roller at home, use one because it'll make this a little bit easier. So I'm going to start off with the soup can right at my belt line area. We want it right at the lower portion of the lower back. I'm just going to slowly lower my body weight over that can of soup. What you'll notice is this creates kind of like a pinpoint spot where it will start to stretch open right at the very low end of the back. The more that you press down with your body weight, the more it's going to intensify that stretch. So really control it by raising and lowering your body weight. What we want to do is get it to the point where it's a very comfortable stretch and hold this for an extended period of time. I would try to start off for 20 to 30 seconds, but if it feels really good, you can hold this for several minutes. Grab a book, use your phone, just take your mind off it. Just do nice, slow, controlled breathing. When you need to relax and take a breather, just lift up just like this. But try to do a couple repetitions, maybe 3 to 5, and with each repetition, take your body weight to press down into it just a little bit more to help open up and decompress the back. From there, I just like to raise the can of soup to target the next spot above and repeat the same exercise. I'm going to do this pretty much from the lower portion of the lower back all the way to the upper. Just really noticing if any spot, like let's say it's right here for me, it just pinpoints that spot a little bit more, and it's also offering a lot of pain relief. If you do have symptoms like sciatica going downwards into the leg, you may notice also while doing this exercise the pain starts to centralize or come back up the legs to the lower back, which is a great sign. That means pressure is being taken off the sciatic nerve. But just go again from the lower portion all the way to the upper, target the spots that you feel need it just a little bit more. To take this one to the next level, what we can do is incorporate a pelvic tilt in there. So I'm going to take my hands, place it over the can of soup, over the spot that we need it the most, put my hands on my hip, and I'm going to rock my butt up and down with my legs. So I'm kind of like tucking my tailbone and then lowering my butt down like this. You'll notice that the lower back will glide over that can of soup, and it just helps open it up just a little bit more. So experiment with this, going from the lower portion, moving the can of soup up and down. And again, if you feel like one certain spot or movement is targeting your pain a little bit better, throw more reps in at that point. You can also do a lateral lean with your body while doing this. So I just straighten my arms like this. I put the can of soup over the spot that needs it the most, and then I'm going to tilt my upper body in one direction. So in this case, I'm going all the way towards my left. This will open up the back just a little bit differently and target a muscle called the QL, or quadratus lumborum, a big instigator of lower back pain. You can hold this one for about 20 to 30 seconds, come back up, relax, and then repeat this 3 to 5 times. With each repetition, try to stretch into it just a little bit more. But go all the way towards the left and then go all the way towards the right. If you do notice that one certain movement works a little bit better for you, again, throw more reps in at that point. Always target the positions and movements that need it the most. If the exercise has helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks so much for watching.